very much. This is the Special Committee on Gun Violence on Wednesday, December the 7th of 2022. I understand that state law currently requires that the following announcement be made at the beginning of every remote public hearing as follows. Due to the current public health emergency, City Council committees are currently meeting remotely. We are using Microsoft Teams to make these remote hearings possible. Instructions for how the public may view and offer public testimony at the public hearing of council committees are included in the public hearing notices that are published in the Daily News, Inquirer, and Legal Intelligence Center prior to the hearings and can also be found on phlcouncil.com. Will the clerk please call the roll to take attendance? Members that are in attendance will please indicate that they are present when their names are called. Also, please say a few brief words when responding so that your image will be displayed on screen when you speak. Will the clerk please call the roll?
Councilmember Mark Squilla.
Good afternoon, Mr. Chair and colleagues.
Councilmember Jamie Gaudier.
Good afternoon, Mr. Chair. Good afternoon, colleagues. Present.
And Chair Mr. Kenyatta Johnson.
Thank you. I think also Shannon Vaughn is also in attendance as well. Thank you. This meeting is now called to order. This is the public hearing of Special Committee on Gun Violence regarding Resolution 170609. Will the clerk please read the title of the resolution?
Resolution 170609, a resolution authorizing the creation of a special committee on gun violence prevention to address Philadelphia's enduring plague of gun violence by facilitating and coordinating among stakeholders in formulating a comprehensive gun violence prevention strategy. Mr. Chair, you are muted.
Before we begin to hear testimony from the witnesses we have for today, everyone who has been invited to the meeting to testify should be aware that this public hearing is being recorded. Because the hearing is public, participants and viewers have no reasonable expectation of privacy. By continuing to be in the meeting, you are consenting to being recorded. Additionally, prior to recognizing the members for the questions or comments they have for witnesses, I would note for the record that at this time, that we will use the chat feature available on Microsoft Teams to allow members to signify that they wish to be recognized. In order to comply with the Sunshine Act, the chat feature must only be used for this purpose. At this particular time, first and foremost, I want to thank my colleagues who thought it not robbery to take time out of their schedule for participating, which I believe is the number one issue that we are addressing here in the city of Philadelphia, and that issue is gun violence and public safety. So I just want to again thank all of my colleagues for being here, as well as all the panelists who will be participating in this hearing. This hearing is specifically focused on getting an update on the progress of the roadmap for a safer Philadelphia, and so that's going to be the focus for this particular hearing. But as I have done every end of this last several years, we wrap up the year looking at the progress we have been making around this issue of gun violence, what our plans are looking into a new year, which is 2024. I'm one that believes that no matter how many homicides that we see here in the city of Philadelphia, there are people behind those actual numbers. And so it's critically important that we wrap up the year focusing on how we can go into the new year, doing a better job, working collaboratively together around this issue of senseless gun violence. And with that being said, I'm going to ask for the clerk to please call the first panel. Do any of my members have any comments or remarks they would like to say before we officially open this hearing? Hearing none, will the clerk please call the first panel?
For our first panel, we have Erica Atwood, Commissioner Danielle Outlaw, and Dr. Ruth Abaya.
Good afternoon, Chair Johnson and the Special Committee for Gun Violence Prevention. Uh, my name is Erica Atwood, and I serve as Senior Director for the Office of Policy and Strategic Initiatives for Criminal Justice and Public Safety. I appreciate, as always, this opportunity provided by Councilmember Johnson to speak about our critical programs. And today we're going to focus my testimony on our Community Crisis Intervention Program, our Group Violence Intervention Program, and our Anti-Violence Grants programs, the Community Expansion Grant, and our Targeted Community Investment Grant. Our Community Crisis Intervention Program, also known as CCIP, launched in July 2018 with only 9 crisis workers. The initial model of the program was a partnership between the city and the Philadelphia Anti-Drug, Anti-Violence Network, also known as PAN. The community-based organization with trusted partnerships in Philadelphia communities most impacted by gun violence. CCIP employs a credible messenger program model to address gun violence in Philadelphia. When we use the term credible messenger, we are referring to individuals who share lived experiences with Philadelphians experiencing gun violence in some of our most hard-hit neighborhoods. Many of these credible messengers have their own powerful stories of how they successfully achieved positive outcomes for themselves, despite the harm or hurt they may have caused or experienced at one point in their lives. As outreach workers for CCIP, our credible messengers are on the front line of our gun violence efforts, and they connect the city to communities experiencing high rates of gun violence. CCIP workers are trained in conflict mediation, intervention in order to mediate and reduce tensions between groups that often lead to shootings. Credible messengers also act as trusted liaisons between community and city staff by connecting residents most at risk of experiencing or participating in gun violence to relevant resources and services. CCIP operates 7 days a week, Monday through Friday. We are out in the community from 12 to 8 p.m., Thursdays and Fridays from 6 p.m. to 4 a.m., and on weekends from 5 p.m. to 1 a.m. Many of these services and supports provided by CCIP are offered at unconventional hours to best meet the needs of our community members. CCIP's program is informed by data and analysis from the Philadelphia Police Department Operation Pinpoint. We use this data to focus on people and places most at risk of violence and to assess whether or not our interventions are effective in being delivered at the right place at the right time. Through our Delaware Valley Intelligence Center, the DIVIC, run by the Philadelphia Police Department, CCIP outreach workers collect data in real time through a web app, Survey 123, commonly known as the 123 app. This program allows CCIP staff to input incident reports, download photos of events, and make notations to forward to social service teams, as well as collect vital information to pass on to their supervisors and ultimately to the Office of Violence Prevention. From July 1st to December 1st of 2022, our Community Crisis Intervention Program teams have made 504 home visits, responded to 1,124 outreach visits, and attended 59 community meetings, held 27 mediations, and have made 463 referrals to their social service unit. CCIP FY23 funding is roughly $6.4 million. At the inception of the program, funding went to PAN to operate CCIP. PAN's current staff is 54 crisis workers. The city is pleased to share that the expansion of CCIP with two new agencies, Eddie's House and the Institute for Development for African American Youth, ADE, starting January 1st of 2023. Eddie's House will focus and cover their efforts of Southwest Philadelphia in supporting the program. And ADE will specialize in incidents involving youth and young adults ages 16 to 24, residing in Southwest and West Philadelphia. Eddie's House and ADE add additional 8 credible messengers to our team, amounting to 70 outreach workers for a total of 4 CCIP. As you all know, the City of Philadelphia launched a pandemic-modified version of the Group Violence Intervention Program, GVI, in August of 2020 as a part of our overall violence prevention strategy, the Roadmap to Safer Community. GVI is a law enforcement-focused strategy that responds to group-involved gun violence by, 1, directly engaging half of 1% of individuals connected to the groups that are involved in gun violence. 2, creating consequences in direct response to shootings where there were previously none for groups and group members. Interrupting the contagious effect of shootings by creating an incentive for individuals to discourage and resist violence to avoid promised consequences. GVI, as implemented in our city, has a very robust social service component that engages participants as well as connects them with requested services. GVI in Philadelphia is incredibly successful when compared to other jurisdictions across the country who also implement this strategy. To date, 27% of GVI candidates requested social service support, the highest among other GVI participants requesting or engaging in supportive services. GVI's social service team also successfully connected 71 of clients to their service of choice. Since its inception, the city expanded the GVI social services component from 2 supervisors to include 2 GVI supervisors, 2 new caseworker staff, and a peer specialist. Each weekend, GVI teams, known as mobile call-in teams, consisting of the same messengers who might participate in a call-in, police, prosecutors, surviving family members of homicide victims, and GVI social service case managers, are strategically deployed across the city based on current analysis of group-involved shootings. Currently, GVI is in all police divisions of the city and in 12 police districts. GVI teams directly engage group members and/or families in communities in which they live. In addition, GVI deploys social service-only teams during the week to conduct follow-ups with individuals seeking services, those engaged in services, and even those who did not request services but are open to additional visits and check-ins. When COVID restrictions began to lift, the city held in-person call-ins to supplement the work of the mobile call-in teams. To date, there have been 4 successful GVI call-ins with representation from the U.S. Attorney, the Attorney General's Office, the District Attorney's Office, the Police Commissioner, the Mayor, and many amazing volunteers, most of which, if not all, have lost a child to gun violence, and other community members who have lived experience similar to the GVI participants. I would like to take a moment here to highlight the dedication and the work of the amazing parents who lost children to gun violence in our city as they participate in our GVI programming. These individuals go out with our teams every weekend and are at every call-in or every event in which we need their participation. They are the true lifeblood of this work. As I testify here, GVI has identified 817 candidates for the program, conducted 1,764 attempted mobile call-ins, team engagements resulting in 533 direct contacts with GVI candidates, which includes follow-ups and call-ins, and 492 collateral contacts with family members of GVI candidates, including follow-ups. In addition, our team has trained 126 individuals to participate in mobile call-ins, team engagements, and undertaking 18 enforcement actions as a part of the strategy. In early 2023, we expect to receive the findings from our program evaluation with the University of Pennsylvania Department of Criminology. We are also we also will announce the onboarding of several new staff, as well as the addition of significant behavioral health component connected to our transitional work. As I mentioned before, we cannot achieve boosted community health and safety without investing in our community organizations. We have long been on the front lines of Philadelphia's gun violence epidemic. To accomplish this, the city invest in 2 grant programs, our Targeted Community Investment Grant and the Community Expansion Grant. The Targeted Community Investment Grant program funds community-based violence prevention programs and activities that improve public safety, increase opportunities for self-development and care, and build a stronger sense of community throughout neighborhoods most impacted by gun violence. Our targeted community investment grants have trauma-informed approaches to gun violence, build resiliency in their communities, mediate conflicts, and promote social and economic empowerment. Examples of the past programs include, but are not limited to, resource fairs, outreach events, job training and career development, neighborhood and community beautification, education works and community workshops, and just general community engagement to develop social efficacy. Our community expansion grant program, which as a sidebar, I will really thank City Council for making this investment, was a historic part of, it was an historic investment of $22 million in anti-violence efforts in partnership. $13.5 million of this invested went to directly to our community expansion grants. Community expansion grants directly funds and supports community-based organizations that are focused on reducing violence through trauma-informed healing, restorative practices, safe havens, and mentorship. The city provides grants ranging from $100,000 to $1 million to community-based organizations that have annual operating budgets below $15 million and a proven track record working in neighborhoods vulnerable to gun violence. By investing in community organizations already combating gun violence, the city aims to avoid disruption of efforts and provide place-based care. Again, I want to thank City Council for the opportunity to speak on this vital work of all the programs that we have that are most critical investments we make in grassroots organizations. Philadelphians are not often made aware of the grueling and sometimes heart-wrenching work of all those on the front line. I hope we are able to convey to you how much goes into these efforts and why we need your continual support in these programs in the future. Thank you, and members of my team and myself are available to respond to questions.
Thank you, Erica, and thank you for your thorough presentation. Just a couple questions. Overall, for the crisis intervention teams, we have 2 new contracts that you mentioned. And what part of the cities are they a part of? IJ and Eddie's House?
Sure. Eddie's House is specifically focused in West Philadelphia. That is where they have a physical location and have the relationships where we want to strengthen work from across from the 12th, 18th, 19th, and 16th police districts in our violence interruption efforts. Day is specifically focused on juveniles. Geographically, they will be focused in West and Southwest based on the data that we have, but we will have them on call to specifically help with any incidents with juveniles.
And the current team that we do have, PAN covers what other areas?
PAN is pretty much citywide.
Really work with them. Citywide?
Yes.
Okay. And what's the total number of PAN workers? I think I heard
the total number of PAN workers is a little over 50, so we're about at 54.
About 54. And with these 2 new contracts, we have additional.
We will, with the new contracts, we will be up to 70 in total.
Up to 70. All right. I just wanted to push because I know the overall budget is $6 million for crisis intervention teams, correct?
Yes.
How much is this out of that $6 million? Do you have an idea, roughly ballpark, $2 million, $4 million? And I'm pushing to see if we can. Are there plans in the future to ramp up even further?
And so the budget that I'm sorry.
Does this cover the full $6 million?
Yes. And so what the budgets not only cover the 70 crisis workers, it also covers supervisors and staff. It also it also covers equipment and supports that are needed. So it's a holistic budget. It's not just a staffing budget.
Okay, cool. Just want to get clarity on that.
Mm-hmm.
And give me an idea in terms of what milestones or key accomplishments in terms of our crisis intervention team that you think we should build on, as well as areas of improvement as we go into the new year. And then the second part of this conversation is, have we explored partnering with, it's kind of related to my another question I'm going to ask. Have we explored partnering with the school district, right? At one time, PAN used to go up in the schools. And the reason why I say it, we have had a significant amount of shootings. outside of our public schools as well as our public charter schools. And I know Bethel was doing, his work from that aspect, but from the community aspect, have we explored maybe partnering with Dr. Wallinson to actually send members of PAN and the other crisis intervention teams inside the schools? Because, obviously a lot of the social media beefs actually either trickle over into the school environment or some start in the school environment and trickle out into the streets. That's one part of the question. And the second part is the timing. I think the workers at PAN, they come on at, what is it, like 11 o'clock or like 10 to 7, something along those lines. Maybe Shondell can answer it. But I want to see how we explore also expanding their schedule. Because when they come on, I know they go out and do the work in the evening, but I think there's a gap, Shondell, in terms of timing when they can actually come on, I think, a little earlier. Probably the school hours, 3 o'clock.
Yeah. Council Chair, we do have a day team Monday through Thursday that come on through the day, actually, from 12 to 8. They do cover the schools.
How many people?
How
many people?
Per district, 1 to 2 team per district. So we're talking about 6 to 9 people. It varies per district according to the size of the district. And to touch on your point, excuse me, I'm sorry.
When you say district, you mean police? When you say district, you mean police district, right?
Police area, the area, not only the district, but the area. Yes. So in South Philly, use that as an example. During the day, we have 1 day team consisting of 3 to 4 people, and then we rotate that. If South gets hot, then we'll increase that we'll increase the area to 2 teams. So it really depends. We can shift members accordingly. And when incidents do happen, of course, the neighboring areas that have teams, we can also shift over. And to answer your one question too, about the school district, we are in conjunction with the school district and sending crisis workers as needed to different schools. We work closely with Bethel. I've known him for years, and we have a good relationship. We also have our rapid response team, which incorporates the school district and different entities of the city, as well as CCIP and different community-based organizations as well.
Good. So because it's under your purview, and I know I asked Erica, what are some of your key accomplishments that you believe, and I was with you from day one since this whole process started. Yeah. What do you think, hey, Councilman, these areas we're making progress in, these areas I think we can need additional support in? And I'm coming as an ally in terms of how I can be supportive of the process, not someone, trying to be critical of the process, but obviously it's all of our responsibility to kind of get to the bottom of the gun violence that's going on in the city. So from your perspective.
From my perspective, I think working better with community-based organizations, I think we have a good relationship. But corresponding, when there's incidents, but even though when there's not incidents, I think we can always do a better job of working, not stepping over or onto each other. You don't want 3 and 4 organizations going to a house after an incident. So I think we can always do that better. I think that some of the work we've been doing with Dr. Abaya, looking at the cure violence efforts within the city, is really helping. To kind of bring these organizations together to have one cohesive plan. So I think, in doing that, I think we'll see a better response to the community. We can always improve, and we've had this conversation before. Manpower is always something we need to improve on. Better trained staff. We've been looking at doing that as well. Having a real clear structure as far as accountability. We're always trying to improve that as well. But Philadelphia is a big area, and just because we're ramping up to 70 workers, if you look at it, that's not a lot of manpower in the streets. So I think incorporating more organizations, Eddie's House and IDEA is great, because especially with IDEA, we start to specialize. We will be bleeding into South Philly as well, trust me. But in looking at ramping up manpower, we can't do it all at once, but we can incorporate other organizations, I think, to strengthen the model. I think that's important that we have a Philadelphia model, and that doesn't have to just be CCIP. I think we need to look at how it incorporates other community-based organizations and what they do into what we can have as a cohesive plan.
Now, you hit the nail on the head with that one. Have y'all considered maybe doing a citywide coalition? And
there is one that exists.
It is one that exists?
Yeah, okay. Dr. Abaya will probably testify to it, but she has set a table and this table has been active probably since this time last year, that really brings together all of our interrupter programs. And there's also a table that she has set that she will testify to about our hospital-based interventions. And she and I are working towards getting funding to building the bridge between the two. And one of the things I will that I'll echo what Shondell said is really about preparing the field. There are a lot of good people out here that want to do work and want to have an impact in community. How do we prepare them for this work? How do we strengthen the sector in and of itself and allow for folks to have economic mobility while giving back to community? That is one of the things that I think we really need to strengthen, is we really need to focus on what it truly means to be a credible messenger, the importance of that work as a first responder in community, and how are we supporting individuals in their training, whether they work for us or not, and how are we building a pathway for them to do more to give back to community? Can they be social workers? Can they be case workers? Can they be therapists? And what are we doing for that pipeline?
Awesome. And I think that's critical, the collaboration, the coalition building across all different sectors. I think all goes toward us getting a hold on this particular issue. I want to go on to GVI briefly, Erica. I know some time ago we allotted $2 million to hire staffing.
Yes.
Give me an idea of what that staffing looked like. Also, I know GVI is in Southwest Philadelphia, in West Philly, and has it expanded beyond those particular areas. Obviously, I would love y'all to come back to South Philly at some point in time, but just in terms of in general, has it expanded beyond South and Southwest, and what type of hiring have y'all done since the allocation of those funds?
Sure. I will briefly talk a little bit, and then I'll hand it off to both Deanna and Evangela, who are working on the day-to-day. We are looking to expand. We consistently have open opportunities for caseworkers, for individuals that will go out with our teams. That is something that we could utilize support in getting the word out that we are doing that hiring. As I mentioned in my testimony, we have onboarded new caseworkers, social service supports, and a peer specialist. With that, Dion or Evangela, did you want to add anything?
Yes, thank you so much. Good afternoon, Council Chair. And in regards to the GVI expansion, before we got the grant, we only had 3 case managers, but as of today, we are almost at 6 with an additional peer retention specialist. So we are a team of 7, including myself, that make us 8. We are currently looking to add additional case managers, but the grant has definitely helped us a whole lot with being able to add more staff members. And Council Chair, we have not left South Philly. We are still active in South Philly. We sent 2 teams last weekend within the 3rd and 17th. GVI is currently within 15 police districts. We are within the Southwest Division, South, Central, Northwest. September, we transitioned to the Northeast Division, and we are also in the East. Slightly, we are operating within the 26th police district. We are meeting with the captains from the 24th and the 25th on a bi-weekly basis to explore deployment strategies as to what GVI would look like if it was to do work within the 24th and the 25th. But outside of that, we are in every district, and we send a team out every weekend, and we do a rotating schedule. So one week we're in South, the next week we're in Southwest. We go out every weekend, rain, sleet, and snow. We don't stop, and we just continue to do our due diligence. And as Erica mentioned, come to start of the year, the University of Penn will close out with its evaluation. So we are really excited about that, to kind of see, what the results of our work. So we really are excited about it.
Good job, Dion. Always being on the case. I remember last time we had this hearing, we talked to you about placement. How does placement look now from then to now? I know you're working hard trying to help these young men and young ladies make the transition from the streets to getting their lives together. How has GVI impacted on that particular area, and what does it look like now, numbers wise?
Absolutely. I think, as Erica mentioned within her testimony, our numbers within the city of Philadelphia compared to other GBI's jurisdictions are the highest in regards to social service requests and connections. Our partnership with the Center for Employment has been pretty unique and awesome. We have a GBI work crew thank you to Erica for setting that work crew up for us at Mount Moriah. We have had a work crew over there consistently full staff for the past 4 months. And our retention rates continue to increase with the help of having a peer specialist, just having someone with them to be able to hold their hand. So it has been a pretty powerful component of some of the work that we're doing. I think obviously GBI is not a social services model, but I think we are really have dotted our I's and our T's with that, and has really just been a very unique process. And I have worked closely with your office as well to be able to kind of have more employers. We just recently, by way of your office, been able to connect 2 of our guys to the Naval Yard. So that's something we are really excited about. And we're hoping to really kind of expand outside of the Center for Employment to be able to kind of give our guys, more of a livable wage. But I think the social service component, to answer your question, has been something that we're really proud of and has really been kind of a well-oiled machine.
Now, let me ask the hard question. How many people we sent to jail that didn't want to comply? Because everybody don't want a job. And I know from the
absolutely. No, and again, obviously our enforcement component is one that we're really, it's a part of our strategy. But Evangela, if you would wish to chime in, because I do know Evangela and our former colleague Brian Lentz kind of took over the enforcement component as well.
So I apologize, Councilman. My camera is having some difficulty, so that you can't see me. But yes, we certainly, as Erica testified, we have initiated 18 enforcement actions, and what we've noticed is that we've been having recent success with cases being federally adopted of significant players within these groups that we're enforcing on. And we are in the process of looking for what we're calling an enforcement specialist, but somebody particular in terms of making sure that all of our partners are aligned. And that we're really being very strategic when it comes to enforcement, and that we're measuring it appropriately. So if there's a case, for example, that gets dropped, we understand where the issue is, and we can follow up on that to strengthen it.
Okay, and for me, that's the critical part. It has to be the carrot and the stick, because at the end of the day, those who do not want to take advantage of the opportunities that we are providing them, they have to understand that there's consequences for their actions. And a lot of times, same way we deal with children, if you don't recognize the consequence for your actions, then you'll continue to shoot, murder, rob, steal, and wreak havoc on the city. And so for me, I've always been an advocate of GBI from day one, because their carrot and stick approach, I believe, does work. And you have to recognize that, everybody doesn't think altruistically as we do. That's on this call, that want a neighborhood that's safe, that want a city that's safer. That's just a sad reality of the state that we're living in. And so when they don't want to take advantage of the resources that we are providing to help them get their lives together, then there have to be some level of consequences and enforcement. And most importantly, you may save some people's lives. So one last part, and then I'm going to let my colleagues ask some questions, so I'll take up too much time. From the GBI standpoint, do you work in partnership with the Juvenile Justice Center? Give me an idea how that works. I know a lot of young guys that's doing the shootings, like some of it starts inside the Juvenile Justice Center. When guys get arrested on the street, they go to the Juvenile Justice Center. There's all kind of beef that's going on. What does that partnership look like?
No, it has been a very unique one as well. Every Wednesday we have our GBI meeting where we meet with all of our partners. So we work closely with juvenile probation, who have kind of a pulse of what goes on within the Juvenile Justice Center. So, for example, if we have one of our juveniles who become incarcerated, due to enforcement action. One of the biggest things for us is we really kind of get together to strategize a plan for when they are released. What are the steps that are really available? We have a caseworker on our team, Mr. Rennie Mayo, who just does such an incredible job. He goes into the Juvenile Justice Center and he works with these individuals as well. And the moment they come out, we're at their doorstep probably 2 to 3 days later. So we provide immediate resources, and we also let those individuals know, and obviously in partnership with in partnership with CEO, that there's an individual who is in custody. The moment they come home, we have a job waiting for them as well. So for us, we provide them with that support while they are in custody, and the moment they come home, we got something lined up for them.
And council member, what I will say to add to that, above and beyond just our GVI program, we have a really strong relationship with DHS's juvenile unit. Deputy Commissioner Gary Williams and I meet on a fairly regular basis to discuss ways that we can collaborate to ensure that we are diverting our young people away from violence into them having a true opportunity.
Awesome. And I just want to get in that, just a brief update, Erica, on the grant funding that you mentioned. I think a lot of groups have took advantage of it from a violence prevention standpoint. And I just want to get an idea of where we're at in that process. You talked about how much we spent. Are we looking to re-up next year? Or are we able to address the multi-year? I would think multi-year funding for some of your key organizations that actually show results should be a part of the conversation.
Yes, sir.
Have we fixed the fiscal agency that will be available to make sure that organizations get their fundings in a timely fashion? Because we do a lot of work on our end, so we want the folks that we're partnering with to also do right by the groups that's doing what they're supposed to be doing. So just give us an idea on that aspect.
Sure. So all things. One, we are currently building out in short order. It's sitting with me right now to kind of put some tweaks on it, is our rubric of how we will reinvest in a number of the organizations that have gotten funding in the first year. There are some that we know are doing some amazing work, and we need to continue that work. We are also looking at developing an opportunity to bring in some new grantees and new opportunities to engage in the program. So there will be a mix of both. And then to speaking to the fiduciary and the fiscal flow, we will say, we have had some conversations. We have gotten to a mutual agreement in how things should be funded. This is not a reimbursement grant. This is a traditional grant. And so we are functioning as such. There are benchmarks in which we are asking our grantees to have in order for them to get their payments. We are now all on the same page. And including the grantees understanding what we have done and how we have set the precedent for this. And so moving forward, I have high expectations that we will not have a repeat of the miscommunication in the first round.
All right, I just want to commend you and your team, particularly around this particular grant program. I remember several years ago when I was in council where neighborhood-based groups weren't getting any funding. And then they went from maybe 20,000 was the max, until now we have a historical investment in community-based organizations, because we know at the end of the day, addressing gun violence is a long-term game plan. It's not overnight. And my goal over this now and next year, regardless of who's in the next administration, will make sure that the key things that have been worked on thus far continues to move forward, irrespective of whoever comes to the table with a new agenda, because it's an historical investment that we've never ever done here in the city of Philadelphia. And with that being said, I'm going to call on my council colleague, Councilwoman Sharon Vaughn, who has some questions. Sharon?
I am here. I just wanted to know, what are the plans to expand this program, say, to North Philadelphia or the Alany area where we're experiencing a large amount of crime. What will we need to do in order to get these type services in other sections of the city?
Thank you for that question, Councilmember Vaughn, and welcome to City
Thank
Council.
you.
It's good to meet you. I will say that both of the programs that we mentioned, both our Community Crisis Intervention Program and our Group Violence Intervention, do operate in the North Philadelphia area. While we highlighted the expansion into West and Southwest, there has been historical presence in the North Philadelphia area, and we can follow up with some specificity to your office just to give you a sense of, and I will also offer, perhaps we do a briefing in the top of the new year for you and other new council members to give you an understanding of what is happening in your neighborhoods, how we are making financial and human capital investments in those neighborhoods, to give you a sense of that. But we are there, and we'll get some specificity to you.
That would be great because there's 7 of us that live in the 7th Councilmanic District. So there's 3 of us. So we are really interested in seeing the crime rate go down in those areas. And that would be the 35th, the 24th, and the 25th police districts. The other thing is, do you do anything with people coming out on probation?
Yes.
Any wraparound services with them?
Yes, we have an Office of Reentry Partnerships that their primary focus is supporting individuals who either are coming out of incarceration, not just with PDP, but with state and federal, as well as those who have not been incarcerated but are on supervision. We support them with social service supports, educational supports, job training, so like forklift training, CDL training, basic needs like getting an ID and vital records. So we have all that. And again, I'm happy to do a briefing with you, just really quickly, if you will allow me this. For your information, there are 5 offices that are in my cluster: Office of Reentry Partnerships, Office of Violence Prevention, Town Watch Integrated Service, Office of the Victim Advocate, and the Office of Criminal Justice. And they all handle supports around reducing violence and reducing disparities in the criminal justice system.
Great.
Thank you, ma'am.
I'm excited. We need some more of this.
Yes, ma'am.
Any other questions from members of council? Eric, I want to go into, I know briefly we had a hearing sponsored by Councilman David O, but it was under this committee with Councilman Curtis Jones. Give me an update on where we're at on, and I did get a response from the administration regarding the money that was allocated, money that was already allocated to the DA's office. And now I have a fuller understanding of there's 2 types of witness relocation.
Yes.
Clients, if I can say that, right? If I can say clients. Right?
Or directly involved.
Yes, exactly. Directly involved versus a threat, right? So just give us an idea of where we're going in the future.
Sure.
Right, regarding witness relocation. We had a discussion regarding the additional $400,000 that was allocated to the DA's office. So give me an idea of how that money, I think, would supposed to be used. If I'm correct, is housed under MDO, correct?
Yes, it is.
That fund is housed under MDO. So give me an idea of how that 400 is going to be utilized. I guess I'll also ask the question, how come it is housed in MDO as opposed to a direct disbursement to the DA's office so they can continue doing what they're supposed to be doing in terms of witness relocation? And I know there's a totally separate area of witness relocation for non-involvement, which I would understand that we would house and keep that 500 and do as we see fit, rather with OVO, rather with PAN, rather even thinking about partnering with maybe a mayor. But give me an idea where we're going in the future. And then 2, why is the 400, in MDO as opposed to, let me go ahead and give it to them to make the DA's office to make sure that they're doing what they're supposed to be doing relocation wise.
Sure. And so, just so for everybody, the two types of relocation are, what is a standard, which most people think about in terms of relocation, is individuals who have witnessed a crime or been a victim of a crime that no longer feel safe in their residency and are that are cooperating with law enforcement and the DA's offices. So there's one type of traditional relocation in which those are the individuals that are moved, and that is predominantly handled by the DA's office. And the classification of that relocation is that you are actively involved in a case that you either witnessed or directly involved in. So that's bucket one. Bucket two is you are adjacent to violence. There is potentially an imminent threat, but you are not actively involved in a case. So those are the two ways that we are bifurcating witness relocation. Now, the DA's original investment and their budget line item for relocation is for part one. Part two, in which we have the $400,000 coming from MDO, is for us to do a mix of both with partnership with them. And so it allows flexibility for us to be able to support moving someone who may not fall within this bucket of one, but there's a partnership here. And so we are in the process of developing what that bridge looks like, but we also have this bucket over here that allows us to move folks who are in imminent danger, but not directly involved in a case.
Not directly involved.
Yes.
Okay. So how close are we in terms of utilizing that 500? I know about the 400. Is the 500 just going to be parked until we start the new relocation program?
No. We are actively in the process of hiring a relocation specialist who will sit in the office of victim advocate, this will be their job. So they will be predominantly focused on how we can make sure people feel safe. That their homes are sanctuaries, and so they are not constantly under the threat, feeling that they're under the threat or literally under the threat of violence. And so that is part and parcel of where we are going with that in the immediate. We are also looking at, now that we've expanded our providers, partnering with Philadelphia Anti-Drug and Violence Network and Every Murder is Real around supports they can give, and so we're able to reimburse them or fund moves for individuals that they are supporting, as opposed to it coming out of the contract that we have for them. So this will be something that has been happening. We will continue it, but in our response, you saw that we have an actual strategy on paper that we will be facilitating.
Good. So we keeping that 500.
Yes, sir.
To build out our program. Okay, that's what I want to get clarity on. No problem. And I'm cool with that. And the 400, right, is for a partnership. So we may have some that's directly involved. Come on over and get this money directly involved. If they're not directly involved, but also we can still use a little bit of that 400 for that as well.
Because that's a flexibility the DA's office has never had before.
Cool. I just want to get some clarity. But we on the same page. And I think it's extremely intelligent to bring a person in-house to say, okay, they're not directly involved, but we're going to be working to help individuals who are threatened, who are more likely going to be threatened for the most part. And a lot of times it's just intimidation, period. To not even think about getting involved if you saw something. That's good. But obviously right now, in the meanwhile, while you're putting it together, if I read correctly, Penn has been helping people in these types of cases get relocated.
Absolutely. Okay. Yes. We're just because we don't have a person doesn't mean we're not doing the work. We're doing the work.
Not doing it. Okay, cool. And from my understanding from the Office of Victim Advocate at DARE, y'all working on long-term placement as well.
Yes.
So not just so much temporarily in a hotel, but long-term and helping the other quality of life issues that impact individuals as well.
We are, but I will say this is my personal opinion on this, and not a policy. I think that we have to be careful of that in that displacement oftentimes is a driver of violence. And so when we move people to a new neighborhood, that often opens up them up for new vulnerabilities. And so let's figure out a way to cool the block down. And so folks can still continue to live in their neighborhoods. I live in Southwest. I love Southwest. I don't want to, no offense, council member, but I don't want to have to move to North Philadelphia because I love my neighborhood.
Yeah.
And so if we can keep people in the neighborhoods they know and love, let's do all we can to keep them safe at home.
I will agree, because everybody don't have the economic wherewithal, right, to move. But sometimes beef is beef.
Yes, sir.
And we got beef for a little bit, and depending on who life you take, it may be beef forever, right?
Maybe beef for generations, which we know we've seen.
Yes. And that's why sometimes when they tell folks for witness relocation, and unfortunately we see this happen all too much, when we move you, that means stay where you at, don't come back. And what happens is a lot of times when people do come back, we get named several instances where people lost their life to senseless gun violence because they decide to come back on the scene. But very, very thorough response. And so everything was right on point, particularly regarding that particular issue. Have no more questions for you. Just a couple for Dr. Ruth Abaya.
Good afternoon.
Doc, how you doing?
Doing good. How are you?
I'm doing pretty good. Can't complain. Just give me an overview, hospital-based intervention. I know some time ago we were supportive of myself and Councilman Jamie Gordon, some funding to help expand the dashboard and the purview of work that your office have been doing and the hospital-based coalition and so forth. And so just giving an update of where we're at in terms of addressing gun violence from a public health standpoint.
Absolutely. And is it okay if I just launch into my testimony? Is that appropriate?
Sure, absolutely.
Okay.
Yes.
And that might answer some questions, and I'm, of course, happy to answer more. So thank you all. Chairman Johnson, councilpersons, Jones committee members, I really appreciate you inviting me to the session today. So as you all know, our city faces a public health crisis as firearm violence is devastating Philadelphia communities. And the lives lost and the injuries that victims of violence are sustaining has an impact not just on those families and communities, but on each and every one of us. And I have no doubt that everyone sitting here today is sharing in this heaviness of heart that this violence causes. But I'm also hopeful that we all share a sense of purpose and commitment to strategic and community-centered approaches to violence reduction and to improving on and better understanding our efforts. So I have 3 objectives this afternoon in speaking with this committee on how we move forward. The first is to summarize some of the work of the injury program, to your point, Councilman Johnson, in response to the ongoing crisis. The second is to provide a brief summary of the ongoing evaluation work for the Community Expansion Grant Program. And my final objective is a statement on where we go from here and the importance of integrating and coordinating efforts towards collective action. So I'm certain I've testified to this committee before on the general tenets of a public health approach, including understanding the scope and nature of the problem, identifying the factors that are driving it and that are protective against it, and then implementing strategies that are informed by that knowledge and scaling those to effect so that they have the impact that we need. So in moving towards an ongoing understanding of the scope and nature of gun violence and its drivers in our city, our program provides some information on firearm injuries through our injury prevention dashboard, including an overview of the public health approach, which we think is an important framing piece, and then a description of the social determinants of health that we know overlap with firearm injury geographically in our city, and then citywide trends in violence over the years and some demography around firearm violence as well. We also provide some information around ED visits and hospitalization costs, and this information is most useful over time to see how these things are changing. In addition to this, our program runs, as most of you know, the Firearm Homicide Review. This effort has been an important convening of 18 agencies and organizations, all of which touch the lives and communities affected by firearm violence in our city in some way. This effort is grounded in data and has provided us with knowledge of where in the city we interact with people who lose their lives to violence and how we can create opportunities for prevention and services in each agency and organization. So as an example, the vast majority of the individuals that we are reviewing have made contact with health systems. And so that underscores the importance of that hospital-based work in serving towards prevention. But this work is also grounded in stories, a recognition that these are sons and daughters, brothers and sisters, neighbors and friends. We must never lose sight of the real lives behind the numbers, and this perspective should inform everything we do. Some of our core work of recent has really been about integrating practices and knowledge between programs and institutions that are practicing the same model of violence prevention. So we have two coalitions that focus on this work. The first, that was already alluded to, is a coalition of the hospital-based violence intervention programs. And as of today, there are HVIPs in all of our 6 level 1 trauma centers. These centers saw the vast majority, 84%, of all firearm violence survivors last calendar year. So we know that they're the right place for this work. These programs provide trauma-informed care, comprehensive case management to victims of many types of violence, but our coalition is focused on the services provided to victims of firearm violence. Our coalition has been working together to determine how many individuals who have been injured by a firearm might be eligible for these services. And on the basis of age alone, in our initial rough estimates, there are well over 1,000 people each year, given where we are in the gun violence crisis in our city, that could benefit from these types of services. And so we have a lot of work to do. As we work to identify the possible reach of these programs, the coalition has named a few really important barriers to engagement that are worth naming. And that includes individuals struggling with meeting their basic needs, who need support in order to engage in trauma healing, and then better coordination between and within healthcare and city systems. The coalition recognizes that the best way to increase the reach and impact of this work in this population is to create a uniform approach to reducing these barriers. So we're all trying to achieve things together. And our coalition believes that as we work to make programs sustainable through funding, improve victim access to supports, identify access to these services as a right, and standardize the training and support for violence intervention specialists, we can improve the impact of this model in our city. It's been invaluable to have a forum for these experts who are subserving different parts of the city to share successes and challenges and work collectively to overcome these barriers so that we can take that final step in a public health approach, which is scaling to effect. Our second coalition, which was also alluded to, is comprised of the city's cure violence programs. So this model has 3 components: detecting and interrupting potentially violent conflicts, identifying and treating those at highest risk, and then working towards mobilizing the community to change norms. We've identified 4 programs at various stages of implementation and have created a monthly forum for programs to identify common barriers to implementation, opportunities for expansion, and then implement collective strategies. We believe these convenings are critically important in this time of heightened violence. Many of these programs are working in similar communities and are likely even engaging the same individuals. A key component of the roadmap, as you all know, is integration, working together towards a common goal. These coalitions are built on that vision. The injury prevention program has also worked to support the evaluation arm of the community expansion grant program. So I do want to take a moment to summarize the evaluation strategy to this committee. The core goal of the CEG program evaluation is to determine how effectively programs are reaching individuals who are at high risk of engagement in firearm violence, and how effectiveness can be improved, expanded, and built upon. The evaluation is also aimed at determining whether program outcomes align with a reduction in exposure to firearm violence among participants, as well as increased services and opportunities for individuals and communities impacted by violence. The evaluation team has been tasked with evaluating how well program outputs align with outcomes of decreased gun violence victimization and perpetration. And programs have a diverse range of services that they provide, and additional outcomes may include things like improved mental health or traumatic stress, access to employment, and others. So this evaluation should position programs to understand their current impact and grow to expand that impact within their communities. And so I just want to underscore, in summary, success in CEG is defined as a reduction in exposure to violence and increased services and opportunities among participants of the program. So both reducing exposure to violence and increasing services are important. Evaluation activities include focus groups, staff interviews, and participant surveys aimed at answering these core questions. And for each grantee, the team has performed a data landscape analysis that looks at the types of data collected within programs, the methods of data collection, and the timeframes for data collection. This analysis has also laid out the program output categories that each grantee may collect, which include involvement or interactions with law enforcement and the criminal justice system, including gun violence involvement, academic outputs, job-related outputs, social capital outputs, and mental and physical health. And finally, community-level outputs are another category. So members of the evaluation team have also participated in a series of site visits to learn firsthand about the work that grantees are engaged in within their communities. The evaluation team and the technical assistance team have worked in concert. The final evaluation will be completed in early 2023, and we look forward to bringing those finalized reports back to this committee. Finally, I want to say a word on where we go from here. It's important that we stop and acknowledge the pain that so many are feeling. We've lost too many lives as a city. We have too many walking wounded. These are my patients, these are neighbors, these are family members, and these are our friends. In Philadelphia, we have a great deal of activity in the work of violence prevention and response. It's been heartening to see so many community members and organizations, large and small, rise to the occasion and commit to working, often in their spare time, to do their part to solve this crisis. One of the key components of the Roadmap for Safer Communities is integration, coordination, collaboration, and all of these words capture a critical part of the solution. Unless each of us who are touching the lives of those exposed to violence are working in concert, we can have activity without the progress we so desperately need, and we can't confuse activity for progress. It's increasingly clear that there's no single solution that will erase gun violence from our communities. What will work is the development of a coordinated ecosystem where individuals can transition between health systems, criminal justice systems, violence prevention organizations, and the streets of their community with trauma-informed coordinated services to support their health and well-being. This means navigating, sharing data, sharing knowledge about communities and their distinct needs and cultures, and prioritizing the communities that have been subject to disinvestment for generations. And it also means acting as a team where each person knows where their partners and assets are, so efforts are not duplicated, but instead are amplified. In an emergency room resuscitation, when a critical patient comes through the door, there are many members of the team working to save that patient's life. To be successful, each team member knows their role, communicates clearly, and most importantly, is focused on the patient as the center of all activity. No matter how skilled any one provider is, without knowledge of their team and clarity about their role, the patient suffers. But with coordination and collaboration, the patient's life is saved. And it's this image that I keep in mind as we all work together to create lasting change in Philadelphia. Thank you.
Thank you very much. I was going to get into questions regarding evaluation, but I think what I'm going to do is wait until the full report is done. And then when we do a reconvening, then we can get a comprehensive response from you. But give me an idea of the goals for the consortium of hospital-based organizations that are working together.
Sure. So the primary goal is to create a standard approach to optimizing recruitment. So there's plenty of existing data on the impacts of HVIPs on the lives of those who participate in them, as far as everything from reducing subsequent involvement in criminal justice, reducing re-injury, to other kind of more short-term goals like reducing immediate post-traumatic stress symptoms or increasing people's access to things like housing support. And so we know that those benefits exist. What's hard is that each trauma system is recruiting in their own way. And there's going to be some individualization for sure, but they're often coming up against the same barriers, and each system is trying to navigate them independently. So is there a way that we can standardize recruitment and enrollment so that each trauma system has that support from the health department and from the city itself to increase enrollment and retention within their programs? It's going to need a lot of things, everything from some of the things we listed, funding so that they actually have the number of violence intervention specialists, trauma counselors, et cetera, that they need, to negotiating common barriers. And so everyone nationwide is struggling with mental health resources for clients. And so how do we address that need for this particularly vulnerable population who has sustained an incredible event of trauma? How do we prioritize them for a service that's in demand kind of for everybody right now? And rather than each institution fighting that battle independently, how do we create a uniform approach to fighting it? Another thing that the team has identified that I think was really novel and important is it's hard to attend trauma counseling and your legal visits and your follow-up medical visits if you're having trouble keeping the lights on. And we say all the time that poverty is a driver of violence, but there haven't really been systems or programs that address that particular driver. We just kind of name it. And so there's a lot of interest in that group to identifying what can we do about that? Can people actually participate in the activities of the HVIP better if they're not struggling to keep the lights on? And how do we meet that need? And can we do that as a group for collectively the residents of Philadelphia who are eligible for these services, rather than each program, which is what's happening now. Each program is bending over backwards trying to meet those needs as they come up. And they're doing incredible work, but it's hard. And so I think that our goal is primarily support and standardization. And then our other goal is right now, if we were to say what percent of non-fatally injured firearm violence survivors have been touched by a program, we don't know that number. That number requires integrative data sharing for us to really know what our current reach is. And that helps us know where we need to go. And the expectation isn't 100%. Not everybody needs a program. Some people have existing supports already, but the number is certainly not as many as it could be. And so that's our other priority. That's the goal of the Injury Prevention Registry. Of all the people who are eligible for service, how many get it? We don't even know that. And then we can decide how many should be getting it and start to bridge that gap collectively. And we hope that the health department is a good forum for all of that information to be centralized. Otherwise, it's kind of siloed in different trauma systems.
Thank you very much. Very thorough, comprehensive review of their goals. And one key area that I think gets overlooked, we talk about homicides a lot, but we never talk about the individuals who are trying to get their lives who are severely injured, individuals who are paralyzed, individuals who have lost a limb, and how they put their lives back together in terms of housing, in terms of just basic things as getting a Social Security card or a birth certificate, right? Housing has been a major issue that I've paid attention to regarding people who are former gunshot victims who are disabled and just trying to get their lives back together and pretty self-sufficient, but don't have the support from the system to address a variety of different issues like healthcare as well as housing. And so you hit it on that last key component in terms of the registry and making sure we're connecting the dots in terms of support. And so I thank you very much. And next on this panel, I want to ask for Commissioner Danielle Outlaw.
Good afternoon.
Good afternoon, Commissioner. How are you?
I'm well, sir. Thank you. You ready for us to jump in?
Absolutely.
Okay, thank you. Kevin, you mind sharing your screen? Good afternoon, everyone, Mr. Chair, other members of the Special Committee on Gun Violence. My name is Danielle Outlaw. I am the Philadelphia Police Commissioner, and I'm joined here by members of, or with members of my executive team, including some of our newest members whom I don't think we've had the chance to introduce to you since they were brought up to the team, specifically First Deputy John Stanford, who's over all things operations, field operations, Deputy Commissioner Krista Dahl Campbell, who is now over organizational services, and Deputy Commissioner Frank Venor, who's over investigations. So per the usual, if there are any follow-up questions afterwards, I will be tapping their shoulders to drill down further. But with that, I'd like to just briefly go into our slide deck. This is just a high-level overview. As you know, we tend to kind of go into where we are, just give background on where we are with the numbers around gun violence, and then touch on some key accomplishments that we've seen thus far this year. So Kevin, next slide, please. So as you can see, year to date, we're down about 8% of homicides compared to the previous year, and we're up 1% in our non-fatal shooting victims. You see that column there for inside. We started tracking inside versus outside in 2020 to be able to track if there are any significant differences, being that folks were more isolated and we were quarantining at the time. But you see the numbers when you relate the homicide percentages versus the non-fatal shooting victims. The decreases versus the homicides that occurred inside is about a 7% decrease, but the shootings that are happening inside are up 6% compared to the previous year. As we move down to the bottom of the slide, these are still our drivers of the violence that we've been seeing: arguments, drugs, and domestic incidences. But what's of note, you'll see decreases here, right? So there's a 3% decrease in our arguments, 43% decrease in narcotics-related homicides, and then the domestics are flat there. You'll see a dramatic decrease in narcotics-related homicides. And I will tell you, we have been hunkering down and partnering, again, very, very closely with our federal partners, DEA, ATF, and just working around the clock to do what we can to get drugs off the street. But we know as quickly as we attack one supply chain, another one pops up. So that one is constantly in motion, but I wanted to set the tone with this particular slide. Next slide, please. This is a high-level overview, again, of Pinpoint. As we all know, Pinpoint is how we at PPD operationalize the Philadelphia roadmap for safer communities. This is the enforcement piece. We're focusing on the most violent individuals or groups, or even areas within the city that are driving the largest proportion of the crime here. And what I want to point out here is when you look at the middle of this slide, you see in our pinpoint areas where most of the violence is concentrated. We're showing year to date a 6% decrease and a 14% decrease, respectively, between our homicides and our shooting victims, meaning specifically in those areas, we are seeing some decreases. I'd like to point out that 11 districts specifically are showing some pretty significant decreases in homicides, and 10 have shown some significant decreases in our shooting victims. If you look, there's a left column and a right column. Those columns, the left column, those districts that are in bold, we are highlighting those not just because they've seen some pretty significant decreases, but those are pretty violent districts. There have been, when you compare them to the previous year, those are some of our most, or have been some of our most problematic, and we're happy to report out that these districts are seeing some very significant decreases there. So I won't read each one of those, but I think that's something that should be highlighted and uplifted for everyone to know and for everyone to see. Next slide, please. I'll keep going back to the number of crime guns that we've recovered. If we continue on the pace, and again, for our audience out there who may not know, illegal crime guns, we're not talking about those who have a permit to carry or they've been turned in for safekeeping. These are illegally carried firearms or guns that have been used in a crime. If we continue on at the pace that we're on now, we're going to hit over 6,200 in the number of guns that we've gotten off the street. We're currently hovering around 5,800. But as you can see, just dating back to 2018, the number continues to increase. We're often asked what's one of the main drivers that you think is driving the homicide, or just the flat out the shootings that we're seeing. And we are quick to say the accessibility to firearms and guns. It sounds obvious, but it really is an issue. Next slide, please. So just going into some of our accomplishments, we've actually gotten a lot done this year as a department and across the organization, but we're focusing solely for the purposes of this committee, because we're talking about gun violence. We're talking about those that are directly correlated to gun violence. Everything that we do has an impact on our ability to prevent and reduce crime, but I just wanted to highlight these. So some of you may recall that we established the shooting investigation group at the beginning of the year, and that was to ensure that we provided the same number of resources or the same types of resources and accessibility to the DA's office, other resources outside the department, local, state, and federal partners with their technology and resources, giving them the same access that our homicide detectives got as well. And we were able to see an increase in our clearance rates, our non-fatal shooting clearance rates, from 19% in 2021 year to date to 23% year to date. Now, you might be scratching your head and saying, why are you throwing that up there as an accomplishment? Here's why. We set the goal for a 30% clearance rate. And even then, you may recall you asked me, Councilmember Johnson, well, isn't that kind of low? Well, yeah, it's low, but remember, we were in single digits and the hovering around 12 at one point. So I think this is showing that this is working in its current state and in progress. And as we're able to promote more detectives and align detectives with where all of the, where most of the crime is happening, I am confident that we'll see that number go up. Another good thing is that there are currently 40 warrants outstanding for non-fatal shootings. So once we that will add to our clearance rate as well. There's a lot of work that's being done behind the scenes. As it relates to the homicide unit, we talked a lot about the clearance rates there. When you compare today to the same time last year, the homicide unit's clearance rate has increased from 42.7% to 47%. Well, effective December 4th. So you see, that's a significant jump there, and we expect to continue to see those numbers increase. The homicide unit has also increased their arrest warrants issued from 109 to 2021 to 114, despite a lower homicide count in 2022. And there's 32 outstanding warrants that still need to be addressed. So there's work being done. That's why we're emphasizing that. There's work being done. We're identifying folks. We're getting people in custody. And I believe with the work and the focus that we're employing, we'll continue to see those numbers increase. We also enhanced our training for detectives. This was really, really important. Sometimes, again, we have to rely on our state and federal partners as well as outside vendors to give us the best practices and what's going on in training. But making sure that our detectives have the training that they need to stay on top of the ever-changing landscape of what we call crime is very, very important, especially since we know that social media is one of the preferred modes of communicating intentions, but also gathering data and intelligence. And then the Office of Forensic Science also implemented a new training program for their new forensic scientist trainees. And $25 million has been allocated for over 5 years to make enhancements there. And they also launched a dedicated gun violence DNA program to expand our DNA collection and analysis, which yet again is using DNA in a different way to make sure that we're not only identifying those who we're trying to get, but to make very relevant linkages to allow us to prevent the next shooting from occurring if possible. Next slide, please. In the beginning of the year, we talked about how we were honored to be selected to be a part of the National Public Safety Partnership. We've really pushed the button on this, the accelerate button, if that is a thing, on this, in that, this project, typically it would take 3 years of assessments. And we made it very clear, I made it very clear to them, and I appreciate their blessing in acknowledging this, that we don't have 3 years to figure it all out. And so we got a lot of assessments done on the front end, and we're ready to not only review the recommendations that came from those assessments, but start really looking at how feasible it is to implement some of the recommendations, specifically around crime analysis, the non-fatal shooting victim assessments that were done, a technology assessment and inventory, and then Crime Information Center and Mobility Project, which is our directed patrol. There was an assessment done on that as well. The Mobility Project continues to be an amazing enhancement for us. Again, for those who don't know, that is really bringing the officer's ability to get a lot done at to the palm of their hands via cell phones. This is ensuring that we're not only able to keep boots on the ground out in the field, meaning that officers don't have to go back into the office, make phone calls, find a contact for L&I and other things, but it's also ensuring that our detectives and our supervisors are closer to their customer base. They're more accessible. Individuals and families can contact their assigned investigator because they now have, it sounds so basic, but a department of this size, it requires the resources and it's quite costly. But it's really putting their ability to do their jobs in a much easier, portable way, so we can be accessible, we can work in real time, and we can get these done. The original pilot showed some promising results from 3 patrol districts and some investigative units. And as I mentioned earlier, we believe that it assisted us in increasing our crime rates, our arrest rates, and really enhancing our ability to share information between the department and community members. Currently, we have about a little over 1,400 smartphones that have been deployed, and it's currently being expanded citywide. Next slide, please. And then I'll just wrap up with this and be ready to open it up for some questions. We talk about gun violence a lot, but we also have to talk about those who are experiencing some form of mental health crisis and or addiction. And there's an overlap there. And we have expanded our crisis intervention response teams. You might recall in the beginning of the year that we were piloting, but we recently expanded what we call our CERT teams and our police assisted diversion. And we graduated a very large group that went through a very lengthy training in order to create a behavioral health unit. We graduated, I think they graduated last Friday. It was a great accomplishment. But in addition to having folks embedded in our radio room, enhanced training, not just for dispatchers and for officers, we will have an increased presence in the community that allows us, along with our clinicians and our service providers, to co-respond and to best triage the types of calls that we should and shouldn't be responding to. And I think that's just an absolute plus in enhancing trust and allowing us to prioritize and send our officers to the calls that they need to be going to, so we can not only reduce our response times, but make sure that we are where we need to be. So I think that's a really, really big deal. But with that, we will open it up for questions. I believe that's the last slide.
Yes, thank you. Very, very thorough, Commissioner. I don't have a lot of questions, but a couple. But I know you always stay on the case with your team addressing this issue of gun violence, but most importantly, keeping our city safe. So this is more just an update, and I welcome your new members to the team. What did stick out, though, what do you think is contributing to the reduction in homicides in those two categories you just showed? Which was significant is that one of the categories is like areas where there's significant gun violence compared to the second category. So from your perspective, what do you think are some of the key drivers in those reductions?
The strategy works, and we have to stick to the strategy. I think that's the important thing, right? Are we flooding the areas where the crime is occurring? And we recognize, and the team and I, will be prepared to talk about this probably in a couple of weeks or so, but we have to constantly reevaluate and reassess where the data and the intelligence takes us. If a certain district has been cleaned up, for example, are we ready to move on to another district and say, okay, our pinpoint grid is now shifting and adapting? And I think we'll be doing some of that in the near future, and we'll be able to talk about that in the upcoming weeks. But we have to stick to the plan, and there's going to be times where it looks like it doesn't work for various reasons. There's going to be outside influences or factors, but again, we got to stick to the plan. So that's the first thing. Making sure that we're aligned, which is what we have been doing with our partners, whether it's Dr. Abaya's folks, whether it's Erica Atwood's folks, ensuring that we're all focusing on the same areas and flooding those areas and giving people the attention that they need, but then also voicing and advocating to community that once the police move on, we need to ensure that there are services there to sustain the efforts. Because yet again, to your point that you made earlier, Councilman Johnson, everyone, fortunately, they might not pass away from a shooting, but there's still aftercare issues or things that they have to consider for the rest of their lives, being shooting victims. And we also have to pay attention to those folks that have been shooters and look at the correlations between shooting victims, because we know that there's correlation there. So all of that to say, we're moving with intentionality. We're following the data and intelligence. We're putting the resources where they need to be, but we're also reassessing and making sure that we're making the tweaks and the adaptations as needed. And I will tell you, lastly, I cannot stress enough how helpful our partners have been. We've called in during the year, and I didn't put it in the slide deck, but the state police came in and they helped us and partnered with us on certain days of the week. The DEA, the ATF, our fugitive task forces, the marshals. When we talk about these warrants, we have our partners over in the marshals that have been able to go over and, pick up these people right away. Very, very, very dangerous people. And, DC Venora will tell you that the technology has been key to solving a lot of these cases, because we're still seeing some challenges with witnesses coming forward, but because of the video and then the ability to utilize that video, we've been able to not only identify individuals, but solve a lot of these cases. So we have to, continue to bring things to scale, continue to invest in technology, because the nature of crime is changing so much, and it's outpacing our ability to keep up. But we just have to continue to stay on top of it.
Let's talk more about the violence prevention DNA program. That was on one of your slides around forensics and so forth. And I remember several different hearings. Forensics has been a subject of conversation, right? In terms of making sure that we have all the proper information to make charges stick. How I see the investment over the next 5 years. So how are we doing in that area in terms of technology, forensics, the investment toward having the proper information as the case moves forward to the next law enforcement agency?
I'll call Director Garvey, Mike Garvey, who can answer that for you.
And I took the tour as well of the forensic unit, and it was actually a very, very informative tour.
So, hi, I am Michael Garvey. I am the director of the OFS, and I was happy to have you out for the tour. And I would put out there for any new member, if they would like to come over for a tour, the door is always open. So, to answer your question, what we've basically done over the last 2 years with the 4 to 5 million that council already pushed over to us is, first, what could we add in to our current building, which, as you know, coming on our tour, we are very tight on space. But what changes to our procedures could we make to even add on more capabilities with what we currently have? So that's what we've been doing over the last 2 years, which is adding in that program by which we now concentrate a certain team on working evidence from gun crimes. Through the last year, just in that program by itself, we worked an extra 2,000 items than what we would previously have, generating leads in a more timely way. That program in and of itself proves to us what we've been saying, which is if all evidence came in and could be worked in a timely manner, we would generate actionable leads that would help close cases more quickly. So for the next 5 years, what we're hoping to do is looking at what are the possibilities of adding on capabilities. Now, the reality is we're out of space here, and our people already produce within the top tier of labs across the whole country. I honestly can't ask them to do more. But what we know is if we have more space and more people, we can take these same procedures we're seeing great value in and apply it to everything, which would be great. So right now, we're working with public property to see what are the options for getting more space to be able to hire more people to do even more.
Thank you, Mike. Just wanted to get an idea of where we're at in that process. I know at the end of the day, And it's been expressed several different times that in order for us to continuously bring down the homicide, I guess, clearance rate or the shooting rate, the forensics has been a subject of conversation. So I'm glad we're going in the right direction in that area. And then the last but not least, Commissioner, before I go on to the next panel, and I don't know if this was probably a question for your team, or can I save it for the gun violence task force? But obviously I looked at the trend. You said, well, we probably make 6,000 plus recovery of guns. And obviously, then that begs the question, what are we doing to track down where the guns are coming from? What are we doing to make sure those are selling guns illegally are prosecuted to the full extent of the law? And most importantly, making sure those who aren't supposed to have a gun don't get a gun in the first place. Do you want to just share any additional? Normally, I would talk to the Attorney General's office about this particular issue because obviously they're charged to track down where these guns are coming from and making sure they don't get inside anyone's hands. And so what I want to just say to you and your team, one, I commend y'all for the progress that we are making. And so for me, rather is one homicide solved or 10, that's progress in the right direction. And so I do want to publicly acknowledge the work that you and your team are doing, particularly around those numbers that we've seen drop in the most violent districts throughout the city of Philadelphia. And like you said, the model works and we need to just stay steady and play the long game, And I think the investments that we're doing in a variety of other issues and the enforcement, I always say prevention, intervention, and enforcement, right? Comprehensively, that's just how I see things. Intervention, finding a way to intercede. Prevention, finding a way to invest. And enforcement, some people just got to go. That's just the reality of life that we can't shy away from when it comes to dealing with this type of issue. And so to you and your team, thank you. Keep up the good work. Anyway, I continue to be supportive. Let me know. But one thing did just pop in my mind because we have an issue around recruitment. Where are we? How are we going about beefing up, promoting more people to put in that homicide unit, also recruiting more rank and file members so we can have more Philadelphia police officers on the streets throughout the city of Philadelphia, walking the beat in cars. I used to be scared of bike patrol, but we ain't going to talk about that. Very, very effective. You can't even hear them when they come up on the corner, like a little whistle, Sharon. The next thing you know, they standing there saying, what you doing? But any update on what we're doing recruiting-wise, manpower?
Sure. And just so everyone knows, DC Robin Wimberly had to participate in an arbitration today. So in her place, we have Staff Inspector Hooven. But as the Staff Inspector, hey, Mike, as he's coming on, I want to let you guys know all is not lost. It's no secret that our class sizes are nowhere near what they were prior to my arrival here. But the good news is that people are still interested and our class sizes are smaller. We have a class on Friday that's about to graduate of about 37 and another class hovering around 30-ish or so on Monday. And we've recently promoted over 150 folks throughout this year, including making sure that a lot of those individuals were detectives that went to either the shooting investigations group or in other parts of the city for detectives. So we are definitely on that piece, but I will turn it over to the Staff Inspector to talk about our recruitment efforts and where we think we'll be in the upcoming year.
And Commissioner, just before we turn it over to Michael, I just wanted to correct one part of your statement. No, all hope is not lost. We don't believe that because your numbers shows the opposite.
That's right.
So if you can reduce with the numbers you have, obviously as you expand, we can do more, and we want to be supportive of those efforts.
Thank you.
Michael, you're welcome.
Thank you, Commissioner. Thank you, Council Chair and members of Council. So a brief overview of how recruitment's moving and how we've done throughout the year, and we'll continue into the next fiscal year. We're continuing to do our listening sessions on the current climate and ways to improve our relationships with existing partners and our local community and organizations. We're doing a lot more of assistance. We've recognized that the high number of washout for applicants was in the Nelson Denny reading test as well as our agility test. So as a unit, Captain McCoy's done great strides with partnerships with Temple University as well as CCP in reference to reading test assistance. If you're not familiar with the Nelson Denny, there's a whole myriad of not necessarily issues, but conversations about the test of itself, being it's from 1929, and it gets a little confusing for someone that's been out of a scholastic program for a certain amount of time. With that said, we're helping folks prior to taking the test that when they sign up to prepare for that. So our local university has been really helpful with that. With as far as the agility part of the test. Now, when folks sign up, they are aware what they're required to do when it comes to orientation or agility, with being the 1.5 mile run, the sit-ups, push-ups, things of that nature. We've worked in collaboration with Kevin Bethel and his folks at the school district to take different locations around the city as far to bring folks in for preparation testing. And it's voluntary basis. We do it twice a week, Tuesdays and Thursdays, 2 different times. So as far as just to give a perspective of where we're doing it, we're trying to diversify so we get all 4 corners of the city so folks don't have to travel all the way to our police facility in the Northeast to say they're from out, off 52nd Street. So we've been using areas such as in Southwest, we're at Bartram High School. In East Division, we're at Edison. Northeast, we've used our training facility as well as Northeast High School. CCP is still a partner in that. Come spring, we want to go a little bit more South Philly and then the Hunting Park area to Councilperson Vaughn's 35th District, things of that. We're just trying to get everywhere we can with that. So that's been really successful. 2 sessions ago, which had been last week, we had 140 folks show up. We had about 70 last night in the rain. So with that said, that's really good, and it shows people where they need to be and what's expected of them. So we're getting the most prepared they could possibly be to get through our orientation onto the next phase of processing. We continue to work with our faith-based and community organizations. I reach out to several districts for our PDACs and things of that nature to put out our message. We continue to, as the commissioner said, we have approximately 30 going in on Monday, and we have a class coming out this Friday. As far as the signups, our actual recruiting process. So back in May, obviously, we all know the residency waiver was lifted in May. So around that time when we were open in that particular block, we had about 900 applicants. To show we're trending in the right direction, our last open enrollment, we had 1,700 folks sign up. So we're getting a bigger applicant pool, which is fantastic. Right now for that 1,700, I only have names and emails, so I couldn't tell you percentages of how many of those folks are from outside the city or not. I know that is a key question in council meetings. So as that becomes available, I'm sure we'll be able to give it to you. Finances, we were finally given our own standalone budget. With that, we've spent about $11,000 thus far this year, just base maintenance needs so far for the unit. For our recruiting events, it's something as minuscule as banners, tables, setups, giveaways, things like that to draw people in when we're at these events that we host. We also upgraded our technology to an extent. We got 10 tablets ordered. This will allow our recruiters to sign up folks right on the spot, as opposed to saying, here's our flyer, why don't you sign up? This will allow us to get someone directly there, get them in a conversation, engage them, and possibly get their name on a piece of paper that we can use going forward. As far as that budget as well, we're also in the RFP stage of marketing with Odyssey Philadelphia for our media campaign. That's moving through the process. That looks like it's going to be good, as well as our applicant processing system, which will be our ATS, which is the applicant tracking system. What they'll allow us to do is to basically come into the current times with engagement of our applicants. Yes, we track them. We know where they're at in the process, but we want to be able to look at a single snapshot and say, Mr. Kenyatta Johnson, he's here at this particular point. Let's reach out. Haven't spoken to him in a few days. See how they're doing. See how they're faring. See how we can help. So it'll allow us to capture in real time where folks are at in the process, and then you can data mine that on the back end to see if we need to enhance anything on our end to get a particular group more help, or why people are washing out at a certain rate, albeit demographic, geographic, whatever it may be. So we've identified a vendor for that. They're actually going to do a build out on our current EIS system, which I'm sure you're familiar with, which is our new early intervention system. So that's all in the works. That's just a brief overview of what we have and what we're going to continue to do through the new year. I'll be more than happy to answer any questions in regards to recruitment.
Sure. Well, one, give a shout out to Verdell Johnson, right? I know the work that he does. He's always promoting y'all training. He's posting it. Take a lot of pride in his work as a Philadelphia police officer. Always showing what the training, the new class members are doing.
Yes.
Which I think is great in terms of informing the wider public that this is what being a Philadelphia police officer is all about. And coming from him, he's a good guy that everybody knows that loves and respects. So definitely want to give him a shout out for his work that he's doing in terms of the actual training component. But give me an idea of how are you and your team addressing diversity and inclusion? Because I think that's a bigger question that members of council have been asking, separate from the outside residency. And so I think the thought was that if you didn't have outside residency, you would probably recruit more people from the city of Philadelphia, which I think that probably isn't the case at the moment. But nevertheless, I think the thought process around that type of policy is to make sure that our Philadelphia Police Department is a little more diverse and inclusive, particularly around people of color. And so give me an idea of where we're at in that process.
Okay, as far as my purview, there's an overarching process that Chief Morant, I'm sure, would be able to explain a little bit further, her and her team's great work. But as far as my purview, one thing we specifically do is go to the HBCUs down to Lincoln and Cheney to have it that us lifting the resident requirement allowed us to go to Lincoln and Cheney and offer opportunities of folks that might not be from Philadelphia. So the HBCUs is extremely beneficial for us. That's one thing that I've directed my folks to do as far as when we're out on college campuses, where we're going, and then where we stage normally. So you'll see us at major events, you'll see us at job fairs, things of that nature. But during the week, sometimes you might not see us. We hit all four corners of the city based on our recruitment team and just set up. Believe it or not, we get a lot of action at gyms, supermarkets, things that are a little out of the ordinary where you'd think you'd find an applicant, but we do, and we do well at those places. But we ensure that we're constantly putting our folks in the right places where we think we can recruit more and diversify police force.
Cool. Thank you very much. Again, I don't have anything else. Oh, my colleague, Councilman Sharon Vaughn, has a question.
Good afternoon. My question is for the commissioner. Have you been to the 3100 block of North Broad Street to the gas station called SP Traders? Has anyone informed you that there are armed officers at this gas station with rifles, supposedly to protect the business and or the customers?
Good afternoon, Councilmember Vaughn. It's a pleasure to meet you, albeit virtually. I drove past there yesterday.
Okay. All right. Well, so we're making sure that this is not going to become an infectious behavior by other businesses, because it does look very intimidating. Some people, that I asked, they said they feel more comfortable going there, but I don't know if the people that are working there are set up to deal with if someone came with that type of artillery to do their crime anyway. Has the guards' credentials been checked in any way? Well, I don't know if you can tell me that, but I'm glad to know that you are aware of it and that you have been there. And I don't know if it's even something that a business can do legally here in Philadelphia, but it concerned me to ride by there and see the employee on the outside of the business with such a large rifle.
Thank you for your comments on that. I'm going to tap DC Frank Venor just to talk a little bit about the law. As far as overall policy decision, I mean, the law is what the law is, and private businesses are allowed to to hire certified armed security guards within the legal parameters. Frank, is there anything additional you want to say to that or add?
No,
Good afternoon, Mr. Chair and council members. I'm Frank Vanor, Deputy Commissioner of Investigations. And just to reiterate what the Commissioner had said, there are security guards the Commonwealth that are licensed by the state with Act 235 privileges, which means they could carry a firearm while they're working as a security guard. Now, as long as they're legally working as a security guard for a bona fide company, that's all well and good. So do I know that that group is definitely going to, and if there's something, we'll definitely step in and do what we have to do by the guidance of our legal partners and office. But at this point, if any entity for their business wants to operate with a security guard, as long as they do it within the state parameters, they could do that.
That's a lot of firepower to have in that community should something occur. And I'm not saying that the folks that are committing crimes are not carrying high-powered firepower as well. But even with it being a thoroughfare, being a highway, a broad street, a lot of innocent people can be affected if something did happen there. So I just want to make sure that we don't have some innocent bystanders or drivers affected by this individual trying to do his job.
I share your concern. Thank you.
Thank you.
Any other questions from members of this committee for this panel? Hearing none. Commissioner, again, I'm going to give you your props publicly as I do, because I believe you deserve the props, you and your team, for the progress that we have made. And just wanted to again acknowledge that and tell you keep up the good work. Any way that we could be supportive as members of council, don't hesitate to reach out and let us know. Thank you for your time today.
We appreciate you. Thank you for that.
You're welcome. Will the clerk please call the next panel?
On the next panel to testify, we have Patricia Campy and Ruth Moyer. And then also available for the question portion, we have Eve Weiss.
Hello.
Good afternoon.
Good afternoon. How are you today?
I'm well, thank you. Thank you for the opportunity.
You're welcome. You could just state your name for the record and begin your testimony.
Sure. My name is Patricia Campy, and I'm a researcher with the American Institutes for Research, and I was contracted to evaluate the CCIP program. So I'm not sure what. Yeah, I'm not sure what would be helpful. I thought that I would talk a little bit about, from my perspective as a researcher working in the United States and around the world on armed conflict and violence prevention, what I see as effective practice and kind of where Philadelphia fits in that from my perspective. I'm often asked what other cities do to have successful violence intervention initiatives. And I always start with, before even implementing an intervention, cities understand how to accurately measure a person's risk for experiencing gun violence, either as someone producing the violence or falling victim to the violence. And I think we heard earlier today from Dr. Abaya and others about the importance of being able to accurately measure the risk. And the reason why that is important is because you then want to make sure that the intervention, right, is appropriate for that risk. You don't want to mix in a young person who's at very low risk for violence in with folks who are at very high risk for violence. There's a lot of problems when you do that. You want, just like a medicine, you want to make sure it's appropriately tailored to what that person will really benefit from. You also, cities that have success in violence prevention initiatives, they also really understand how to support the needs that people have. And the needs are, done in a very specific way, understanding that it's not so much based on opinion or professional judgment, but it's really getting to know the person, measuring what their mental health needs are, their housing needs, their employment needs, all of these sorts of things. So you can really arrive at a plan and a process that's going to support their needs. And for the population that's really producing the violence, as well as folks who have been victimized by violence, long-term support is needed. This is not something where somebody can quickly change the trajectory of their life when they may have been exposed to violence for, decades or even intergenerationally across family generations. And the problem is that our interventions and our policies, our political cycles are short-term, right? So it's always a struggle to figure out how to sustainably support these folks over a long enough time period so they actually can heal and thrive the way we would like them to be. The third area that cities really need to focus on is what's called responsivity. So you might understand the risk, you might understand the need, but that doesn't mean that the person who comes through the intervention is going to respond to the intervention. And I think Dr. Abaya, as well as Eric Atwood, spoke to this to some degree. So the readiness or the responsivity to these interventions, it lies within the individual, but it also lies within the environment. So within the individual, especially folks who have experienced gun violence, they may not believe that things can be different. They may be struggling with post-traumatic stress disorder, so mental health issues. They may have their own interpersonal issues around development. The younger you go, and I know we've seen so many, young folks involved in gun violence in Philadelphia, you also have to recognize that their brains are not fully developed and, until age 24. And when you're exposed to toxic stress at an early age, it actually stunts brain development and increases the amount of cortisol in a young person's brain, which makes them more fearful and less dependent on what we think of as our rational part of our brain, where we can make a cost-benefit decision. Young people exposed to violence, their brain development is altered as they expose toxic stress, and they're much more likely to think impulsively, which obviously is a bad combination when you think about violence. So that's the internal side of responsivity, but externally, the community has to be ready to help these folks take a different path, right? So there needs to be, employment that is appropriate for folks. So, a lot of folks, one of the most common factors when you look at folks who are incarcerated is very low levels of literacy. Many of our young people are pushed out of schools because of behavioral issues, but also, that is tied to maybe not having the supports they need to do well in school. They could be bullied, they may have special education needs, even something as simple as a pair of glasses results in them, feeling like they're stupid or they don't want to go to school because they can't see what the teacher writes on the board. And so when they're called on, they sound stupid and they're embarrassed. And so they stop going to school. When that happens, they become vulnerable, right, on the streets while their parents are working or whatever their home life is. They become vulnerable to be pulled into, criminal enterprises and exploited and those sorts of things. So cities that really are successful, they pay attention to all three of these things: understanding the risk, making sure that they can support the needs people have, and making sure that they do everything in their power to help people respond to these interventions. So 100% of people take advantage, like of the GVI program, and not just 27%, which is great, but it's still a long way to go from everybody. But even in the best case scenario, when cities follow these steps, and an intervention has been shown to be effective elsewhere, it doesn't mean it's going to be effective here in Philadelphia. So, interventions are sensitive to the people and places where they're implemented. So we would like to plug in cure violence or focus deterrence or GVI from somewhere else, but you can't actually do that and expect to have the exact same results. And I could share numerous examples of my experience doing this in the United States and in Central America, where it just doesn't work. So So contextualizing it, I think Shondell mentioned this, the Philadelphia model, that's really important, but it doesn't mean that you don't follow the evidence. You also have to really understand what works and take a science-based approach to this, because violence is preventable. And there are numerous examples around the country, and maybe some early examples here in Philadelphia with the commissioner's data that shows that you can decrease the violence. It's not a throw up your hands, nothing works kind of situation, but we do have to be willing to follow the evidence and put the resources in that are needed. To that point, I think community-based organizations were brought up by Erica Atwood and others today. You know, these organizations in the community who are best situated to help our young people avoid violence and turn around their lives, they often don't have the readiness as organizations to train their staff, to hire their staff, to make their payroll every week, to have a safe building, to have transportation. They need a lot of support to build that capacity so they can deliver high quality services. And you know, if they're implementing a program that on paper has effectiveness, but they don't have the right training for their staff or supervision or pay for their staff to implement that intervention well, the intervention is not going to be effective and it could actually do harm, right? So really investing in these organizations to have the critical supports they need is imperative. And I think you probably saw that in the report I issued on the CCIP evaluation. You know, the intentions are strong. From both a program model perspective and a day-to-day worker perspective, everybody's working really hard, but the infrastructure, the process, the supervision, the learning, the data, the training, that has to be in place if we want an intervention like CCIP to succeed. Lastly, I would say there's a really important piece to the puzzle here that goes beyond any single intervention, and I think Dr. Abaya and others have spoke to this. It's the role of policymakers, folks on this committee, as well as folks in the executive legislative branches and our agency leaders across the board. And that is really to have this commitment to evidence and learning and improvement. And what that means is, you know, having panels like this that are really looking at the issues objectively, putting our opinions aside and listening to the evidence, listening to the data, hearing from the community, making sure we're not just speaking in an echo chamber, and making adjustments when the outcomes that we thought we would get, we're not getting. And making that long-term commitment to the future, because at the end of the day, we want to put things like CCIP out of business, not because they're doing a bad job, but because they're doing a good job. But they could be very successful with the very high risk folks they're working with and still have more clients coming in the next year. Why? Because we're not focused on the prevention, right? The upstream prevention that needs to happen in the schools and in the families and the communities, and investing in places that have been disinvested in for generations. So that's what I wanted to share with you all today. I'm happy to take questions on this about the CCIP evaluation or anything else that I raised. Thank you very much.
Thank you very much. Just in terms of the evaluation for the Community Crisis Intervention Program, you talked about a couple of issues such as management, internal coordination, staffing, lack of involvement by community stakeholders. Give me an idea from your perspective how these issues are fixable, remedial steps in addressing the issues, and your overall recommendations in terms of a course of action moving forward.
Thank you for that. So I think in my experience, what the two essential pieces are: one, having a program director who is directly responsible within the program for making sure that things are being implemented properly, staff are being supported, data is used to help staff learn and improve over time. The research is really clear that compliance monitoring does not produce better outcomes. It produces better compliance with process, but people lose sight of the purpose of why they're doing the work when the focus is just on compliance. So you need a program director that's respected by the staff, who understand the nature of the work on the streets, who know what training supports those people need, who know how to hire the right people for those positions, what compensation they need, and as Erica mentioned earlier, how to professionally develop that workforce so they have a career path. The outreach workers, there's no reason why they couldn't be running the organization of PAN. And PAN was started by an outreach worker, right? That's their history. So there needs to be a pathway for those folks, or they're not going to be invested in the work, and you'll lose them over time. The second component is that community involvement, which includes the agencies. In my experience, it's essential on a monthly basis, at least, to have the agencies come together, including the police department, to sit around the table and talk about what's working well, where the barriers are, to specifically talk about specific neighborhoods, individuals, situations, and collectively think about how can we reach that person. This area is starting to get difficult. What should we do there? So you can always get ahead of the problem, and you can praise the work because it's exhausting. Everybody feels so, desperate at times in this work. And when you're just by yourself and you don't have the whole team around you, to what Ruth was saying before, you don't really get to see the whole picture, right? So it can be very energizing to be around the table and hear that, oh, no, I can help you there. We've had, a lot of success in that part of the city. Or, oh, I didn't realize that was a problem. We have data on that we can share with you. So I don't see that happening that much. I think the coalition Dr. O'Brien mentioned is a good start, but I think CCIP organizations like PAN, they need to bring together these actors on like I said, at least a monthly basis to specifically have these kinds of conversations.
Okay. All right. Well, one, I want to thank you for your time. And really giving us an overall insight into the actual program. I come from a program called City Year, the AmeriCorps program. We used to say, what get measured gets done, right? Because we always get a chance to reevaluate on a weekly basis consistently our goals, our objectives, and then we also have a chance to re-strategize based upon what the data is telling us. And so doing this type of work, and that was social service work as well, but it was more along the lines of volunteer public service, right? Where this is dealing with people's lives day in and day out, and it can be exhausting, but you also need to be able to look at the data to make sure we're not just spinning our wheels going in the same direction, especially the people who are actually doing the work have to feel supported and encouraged as they go about doing this. So I do want to thank you for your insight. Next, I'm going to ask for Ruth Moyer, who also did an overview of our GBI program, to begin her testimony. How you doing, Ruth? You're on mute.
Hey, Councilman. So good to be here. And it's been such an honor to be able to work on the evaluation of GVI for the University of Pennsylvania. So I'm going to, I prepared a slide deck. Okay. So here we go. I'm trying to move it to the next slide here.
Oh, sorry, Ms. Moyer. This is the clerk. I have control of your presentation and I'm presenting it. So just let me know when you need me to move to the next one.
Yeah, move to the next slide. Thank you so much.
Okay.
Thank you. All right. So first, I'm going to give you a roadmap of what I'm going to be talking about today in terms of GVI evaluation. So first, I'm going to give you an overview of the quantitative analyses that will be in the report that is due at the end of January 2023. I'm going to go over some of the considerations that I had to deal with in fashioning this evaluation, the data that was used, the precise questions that are asked and will be answered in the report. I'm also going to talk about an overview of the qualitative work. And before I begin, the indications are that GVI is an effective strategy. However, findings will not be reported until the January 2023 Penn report. So if you're wondering, like how much did it actually reduce group violence, you'll have to wait till the report until then. And I'll be happy at that point in January to answer any other questions that the committee has. Okay, all right, Brett, next slide. Okay, so key considerations guide quantitative evaluation. So the overarching question that guided this whole evaluation process was whether GVI is reducing firearm violence in Philadelphia, and specifically group firearm violence. So this isn't firearm violence stemming from necessarily domestic issues or random strangers. This is the firearm violence that is some way connected to groups. And throughout the evaluation, shootings can be defined as either an injury or a fatality. So in a randomized controlled trial, which some of you probably have heard of, like in terms of medical research, is generally not suited to evaluations of criminal justice programs. Okay. And that's where you have 500 people are randomly assigned to treatment, 500 people are randomly assigned to control, and that doesn't necessarily work when you're doing this type of evaluation of an in-the-field criminal justice program. So instead, something called a quasi-experimental design is what researchers use in the social sciences. And what that does is it takes advantage of some type of variation in time or place in which something was implemented. And it was quite fortunate that GVI was implemented at different time points and in different places throughout Philadelphia. So for example, it started in Southwest in August 2020. It didn't move to I believe it was the central division until early 2021. So that was super useful in terms of determining the effect of GVI when you have that type of variation in place and time. Okay, next slide. Okay. All right, so just an overview. These are just some of the data sources, not exhaustive, that's used in the evaluation. January 2020, May 2022. The data comes from the Delaware Valley Intelligence Center, DVIC, and the Philadelphia Police Department, as well as the Office of Violence Prevention. And I also use some contextual data too from the U.S. Census Bureau. Okay, next slide. All right, so the evaluation, it quantitatively assesses the effect of GVI on shootings, right? And the main levels are group unit level, place, which is more precisely census tracts, and the individual level. And the reason I did all these different levels is because it enables us to kind of define treatment differently to figure out how exactly GVI might have an effect, okay? And in terms of, I also paid attention, besides outcomes, I also tried to pay attention to mechanisms. So it's a quantitative analysis. So dosage. Does one visit from a GVI team to a group, does that have an effect? Or do you need two? What happens if it's more than two? And I also looked at the effect of enforcement actions. Okay, next slide. So just to give you an overview of what the group level analysis is. Okay, so the outcome is shootings per week per group unit. Okay, so group A, let's say we have group A is the shooter, group B is the victim. So for the analysis, it'll be group unit AB. Right? And treatment in this analysis is defined as at least one direct contact between the GVI program that could be through an MCIT, a mobile call-in team visit, or through a call-in meeting, and a group unit member. And I also look at dosage with this. Okay, next slide. Okay, I also did a place level analysis And those are census tracts in the Central, Northwest, South, and Southwest divisions. And the outcomes are group member involved shootings per week per tract, and all shootings per week per tract. So what does that mean? So I look at per census tract. So per the 122 census tracts between August 2020 and May 2022 that had some visit from the mobile call-in team. There were 122 census tracts in Philadelphia, which is approximately a third of Philadelphia's population. So I look at group member involved shootings as well as all shootings. Whereas for the group unit analysis, that was just group member involved. This is both all shootings and group member involved. And for this analysis, I define treatment as at least one contact between the GVI program and a group member, or between the GVI program and an influential in that track. So let's say a GVI, the group member is not at home, but the mobile call-in team makes contact with the group member's parent. Okay, that counts as a contact for this analysis. Okay, awesome. And I also look at dosage. I also look at spillover, because that's a big concern. Anytime there's some type of intervention like this, are we just simply, we're treating this area, but we're just simply spilling violence into the next area. So that's something I also tested as well. Okay, next slide. An individual analysis. Okay, so this looks at for individuals between who had some type of direct contact, either between the mobile call-in team or a call-in, the likelihood of being shot per month, or the likelihood of committing an offense that results in an arrest per month. Okay, and again, that treatment is at least one direct contact between the GVI program and the individual. Next slide. All right. I additionally tried to figure out like what effect these enforcement actions have, and the outcome is a shootings per week per group subject to an enforcement action. And the treatment occurs once that group is subject to enforcement action. Once it is subject to enforcement action, it is then treated for the rest of the analysis. Okay, next slide. All right. And to kind of give some good context for the quantitative findings, I did some qualitative research as well. The meat of this evaluation, it's going to be data driven. It's going to be quantitative, but I also did some qualitative research. And what that was, I talked to community members informally. I had them do a bit of a survey to figure out what exactly they knew about GVI. I also did surveys with the Philadelphia Police Department, the mobile call-in team who served on the mobile call-in team. And I also spoke directly with individuals who are receiving GVI. And why did I do this? Well, of course, to provide context for the quantitative findings, but also there's a bit of expertise, the folks who are most affected by gun violence, whether the individuals, community members, even law enforcement, they're the ones day to day that deal with this. They're going to have perspectives, and their perspectives about violence in Philadelphia generally, but also perspectives about GVI. So next slide. All right, that's it. Thank you.
Thank you, Ruth. So I just want to, well, one, that's a good overview on the analysis of what you and your team are looking at. And then obviously, we have to be prepared for the results. What time in January are we looking at? We'll probably come back to council around the 21st. So when are we, the week of the 21st. So what are we looking at in terms of full completion of the report?
Oh, gosh, I would say, so if the next meeting is the 21st, I would hope to, I gave myself to the end of January. If there's things that needs to be, done earlier, that's fine. Or
that's not my call. So I'll let you handle it with whoever you contracted with. But I will follow up, with you and your team once the data is complete. The report is complete, so we can do a comprehensive Q&A around the results of the actual evaluation. And just wanted to say thank you for signing up and helping us address what I believe is the most critical issue that we're addressing here in the city of Philadelphia.
Thank you so much. My pleasure.
And you're from my alma mater, so that's extra kudos. So thank you, Ruth. Appreciate it. We will now go into public comment. Will the clerk please call the first person for public testimony?
Absolutely. We may just need to take a quick pause for council support to patch them in.
Sure.
One moment.
Hello? Hello?
Hello. Hello.
Hello?
Who am I speaking to? Hello.
Hello?
First,
Hello.
I believe our first individual to testify is Marla Davis Bellamy.
Yes.
Hey, Marla, how are you? This is Councilman Johnson.
Yes, how are you?
I'm doing pretty good. You can state your name for the record and begin your testimony.
Marla Davis Bellamy.
You can begin your testimony.
Sure.
Hold on, Marla. I have 1 second, Marla. Ruth, are you still there?
I'm
Yes, I am.
Ruth, I just have one small thing, Ruth. In terms of your study, will you be looking at not just also having contact with GVI teams, but also the services and the employment assistance aspect in your study?
So one of the things, because of the time period in which this was implemented, it's kind of hard to do prospectively how much that does have an effect. But is that something, like, just to give a sense of, like, the individuals, when I do the individual analysis, what percentage request the social services, what percentage to advance the social services, that descriptively is something that could be included for sure.
Well, you check with the folks who, did the contract with you, but for me, it just gives a snapshot of what's needed, right? Because this is a carrot and stick approach. It's either you engage in our social services and our employment that we're trying to offer you to get you out of a life of crime and drugs, or you opt out and you decide to live a life of crime and drugs and have to deal with the consequences of your action from the employment standpoint. So that would be a recommendation for me to at least take a look at, just in general.
Thank you.
All right, thank you. You have a good one. Thank you for your time and your testimony. Marla Bellamy, you can now begin your testimony.
Thank you very much, Councilman. It's an honor and pleasure to speak with you this afternoon about the violence prevention and intervention work of Philadelphia's ceasefire, a public health violence intervention program based at the Katz School of Medicine at Temple, as well as the Philly Hub, another ceasefire program, which is comprised of a group of over 70 agencies who meet weekly and are working collaboratively to address the needs of individuals, families, and communities in crisis. A special welcome to Councilmember Harity and Councilmember Vaughn, our new Philadelphia council members at large, and Councilmember Phillips and Councilmember Lozada, our new Philadelphia District council members. My name is Marla Davis Bellamy. I was born and raised in Philadelphia and have been working in the public health space of violence prevention and intervention for over 20 years. I share the concern and frustration of many of you, as well as our community-based organizations, schools, parents, businesses, and families who are losing loved ones and have been deeply impacted by gun violence in our city. I have worked with former health commissioners, Dr. Maurice Clifford, Dr. Robert Ross, former Pennsylvania Department of Health Secretary, Dr. Calvin Johnson, as well as Mr. Kenny Gamble, Congressman Evans, and the Queen Mother, Sister Falaka Patah, and several of our council persons to address this persistent problem of gun violence in the city of Philadelphia. As a former chief of staff of the Pennsylvania Department of Health, I became aware and brought the Chicago ceasefire model, now known nationally as Cure Violence Global, to Temple School of Medicine 12 years ago. Our goal is to reduce homicides and shootings in the city of Philadelphia, utilizing an evidence-based approach proven to be effective in the reduction of violent crime across the United States and around the world. Philadelphia Ceasefire is about working with high-risk individuals that are deeply engaged in high-risk activity, including shootings. These are the individuals, according to Dr. Daniel Webster of Johns Hopkins University, that are not getting enough attention in our existing strategy in Philadelphia to reduce violent crime. However, if we are able to successfully engage them one-on-one and provide them with direction and support, they will make better lifestyle decisions, which will ultimately lead to a reduction in shootings and homicides. We know who they are, and law enforcement officers know who they are. But our approach is similar to the AA sponsor, who is a former alcoholic who works with someone who struggles with the disease. Our sponsors, on the other hand, are called credible messengers or outreach workers or violence interrupters. We hire them from the target community, and they mediate conflicts and also provide case management support to high-risk young men and women with the goal of helping them change their behavior. However, please know that not every returning citizen or someone with a high-risk past is equipped to be a credible messenger. There's a community hiring process where community members and staff weigh in. They're the ones who determine in our program who should be a part of our team. The hiring panel should have some familiarity with the candidate and feel comfortable with sharing any concerns. If they don't know who the individual is, we will not hire them. We also have a representative from the Cure Violence National Training Team who interviews our finalists, and they weigh in as well. The case management support that is provided by our workers includes 5 home visits a month, 3 telephone calls a week, and the goal is to maintain continuous involvement with them and stay in their ear like a gnat constantly. This model is a public health approach which requires the use of data, which helps guide where we should implement the program. I remember former Police Chief Ramsey saying, if you can make this program work in the 22nd Police District, you can make it work anywhere. Well, we took on that challenge, and that's where we started 12 years ago in the 22nd Police District, which includes some of the most dangerous neighborhoods in the city. After our first year, we partnered with the city's Philly Rising program and were awarded a $1.5 million 3-year grant from the U.S. Department of Justice to broaden our efforts in the 22nd and 39th Police Districts. The program was evaluated in 2017 by Dr. Katarina Roman of the Criminal Justice Department at Temple University. Through the evaluation, her team concluded that Philadelphia ceasefire contributed to a 30% reduction in shootings in the target area. Since that time, however, we have struggled to secure the necessary funding to expand this work, while cities like Baltimore, New York City, Washington, D.C., Atlanta, Georgia, St. Louis, Missouri have replicated the model and are on a downward trend in their target communities. Through funding from the Pennsylvania Commission on Crime and Delinquency, we were able to create a means for us to work close with victims and their families by providing 24-hour victim assistance support to over 500 victims of violent crime per year. Also, since the onset of the COVID-19, we have launched the Philly Hub. I learned about this public health approach to crime prevention on a Department of Justice technical assistance call that I participated on. I was so impressed, I traveled to Chelsea, Massachusetts, and spent 1 week with the Chelsea Police Department, who had launched the Chelsea Hub 4 years prior to my visit. During that week, I took part in their hub meeting where 20 agencies gather weekly to discuss individuals who are experiencing a crisis. During the hub meeting, while I was there, a social worker described an incident where someone had been domestically abused. After the date of birth and address of the victim was shared, the group checked their iPads and laptops to see if their agency had provided support to the patient. They also were able to quickly identify additional services that this family may have been eligible for. In addition to this discussion, one of the agencies at the hub must serve as the lead. The lead agency is responsible for following up with the client within 24 hours after presenting the situation to the group. The lead agency also joins with other social service groups immediately after the meeting and strategizes as to next steps. At the meeting the following week, the lead agency provides an update to keep the other partner agencies informed of any and all progress. To date, the Chelsea Hub has engaged in over 800 situations and has seen a 40% reduction in violent crime. Given their success, we brought the representatives of the Chelsea, Massachusetts Police Department, who run the hub in Massachusetts, to Philadelphia and conducted a training in February 2020 with several agencies in the city who were interested in replicating their approach. Following the training and based on data, the group decided to focus our hub in Philly on young people citywide between the ages of 13 and 24, as well as individuals and families in crisis. Our group, which includes approximately 70 members and 30 active agencies, meet every Monday virtually at 11 a.m. Our first situation involved a 19-year-old who suffered a spinal cord injury resulting from a bullet wound. Both the victim and his mother, who is the primary caretaker, are confined to wheelchairs in the home. In this situation, the hub provided the following services within 24 to 48 hours. Behavioral health support was identified. Groceries were delivered the day of the referral and continue. The hub engaged a victim advocate regarding possible victim compensation claims. We began providing transportation to medical appointments and also re-engaged a social worker from Jefferson McGee Rehab Hospital. The hub members that worked in this situation included Mastery Grads, Share Food Program, the 22nd Police District Clergy, PBHIDS, Philadelphia Mental Health Care Corporation, McGee Rehab, and Philadelphia Ceasefire. The Philly Hub has conducted over 112 meetings since August 2020 and has reviewed 57 situations. Currently, we have approximately 70 members, which include city agencies such as DHS, CBH, District Attorney's Office, Juvenile and Adult Probation, Town Watch. We have some school and police involvement, victim services, PHA, therapists, retired nurse. Some members of City Council have reps who attend our meetings as well. We have developed relationships with one another and understand the importance and benefit of working together. What's important is that we are no longer working in silos. We are utilizing our combined resources to save lives and bring peace to our families and communities throughout the city of Philadelphia 24/7. Through this process, we've learned coordination requires dedicated leadership and full-time support. Collaboration, on the other hand, takes time. It will not happen overnight. Building trust with one another is a process. We must also model this kind of collaboration within our own organizations if we expect others to adapt this approach. As for needs of our clients, alternative housing for those impacted by violent crime is significant. We are also one of the few agencies statewide that is working with those that have become disabled due to paralysis or traumatic brain injury. We've also learned that we need subject matter experts to work diligently with us as we work to strategize and provide services. Dr. Bob Ross, in this role as health commissioner, when we had an uptick in violent crime, immediately contacted the CDC, who assigned Dr. Chuchi Saunders, a pediatrician and former medical epidemiologist, to the city of Philadelphia. We've also learned that from other cities, there needs to be an expectation that every business contract in the city will also have some active role in this effort. However, leadership on the local and state level is paramount, and we must proceed with a sense of urgency and elect officials who will make this issue a priority and do whatever it takes to turn things around. Let's visit Baltimore. Let's visit New York City and other municipalities in close proximity to us. I'm sure there is something that we can learn from them. Currently, we're solely funded by the Pennsylvania Commission on Crime and Delinquency and Everytown for Gun Safety. However, whether it's Philadelphia Ceasefire or the Philly Hub, we are committed to supporting community-led, evidence-based approaches and are committed to working collaboratively with neighborhoods, the city, local businesses, philanthropic organizations, law enforcement, educators, returning citizens, elected officials, and anyone who cares and is willing to roll up their sleeves to turn our city around. Thank you very much.
Thank you, Marla, as always, for your dedication and your passion around this particular issue. You've been on the front lines and addressing this issue for several years. And any way I can be supportive, don't hesitate to let me know. I guess it does beg the question, is there any collaboration? And I know about the hub, and I know about the program that you operate out at Temple. Is there any partnership or collaboration with the City of Philadelphia program, Office of Violence Prevention in general? Are you there?
Yes. We welcome any opportunity to certainly collaborate and work with anyone who's interested in collaboration. You know that, we have tried to reach out to a number of entities and organizations, including law enforcement, to work collectively with us, because we know that that's what we'll need in order to really move the needle.
All right. Well, thank you for taking time out of your schedule, giving testimony. And I'll also follow with you online as well. Keep up the good work. I get the emails regarding the hubs every week, so they're very, very helpful to me to stay in tune on what's going on across the city. Tiffany White and my staff also participate in a couple of them as well. So keep up the good work. It's about bringing people together. So any way I can be supportive, let me know.
Yes, thank you very much. We appreciate it.
All right, you're welcome. Will the clerk please call the next panelist?
Our final panelist is Judge Mark B. Cohen.
Hello.
How you doing, former state rep, the Honorable Mark Cohen? How are you?
I'm sorry, I'm not hearing. Hello, this is Mark Cohen.
We hear you, Mr. Cohen. How are you? Mark, are you there? Mark, are you
Hello,
there?
this is Mark Cohen.
Mark, can you hear us? Mark,
Hello?
can you hear us? Brett, I think there's some type of technical difficulties because he can't hear us. I can hear him.
Absolutely. Judge Cohen, also I heard in the background you might be listening to the hearing online. Muting that might also help. Modesto, did we by any chance lose contact, or is he still on?
Yes, we lost him, and I'm going to reconnect.
Thank you so
Hello?
much. Hi, Judge Cohen.
Hello?
Hi, Judge Cohen. Can you hear us?
Hello? Hello?
Mr. Cohen, can you hear me?
Yes, I can hear.
Okay. How you doing, Your Honor? How are you?
Is it time for me to get on the...
Yes, you can now start your testimony.
Okay. Okay, Matt, could you let me on the... Yes. Yes, I'll...
You can
I'll
now
be there.
start your testimony.
Yes. Yes, we're trying to get on the...
You can now start your testimony.
I'm trying to be on.
Judge Cohen, if you can hear me in your phone, you are giving testimony via the phone call that you are on. So I would turn off the online viewing that you're watching because that is delayed. You may give your testimony via the phone call you are on right now.
Oh, okay. I'll give via the phone.
Yes, sir.
Okay, Matt, you said...
Honorable Cohen, can you hear me?
Yes, I can hear you.
You can now start your testimony.
Judge Cohen, are you still connected?
Yes, I'd like very much to be on.
Yes, you are on right now. You are speaking via your phone. You are on with Chairman Johnson. You may give your
Okay.
testimony now.
I'm sorry, Matt. Yes, I can.
Just focus on what's on the phone because this is delayed.
Okay, fine.
You're going to throw yourself off.
Okay, thank you. Okay, members of City Council, Chairman Johnson, Councilman Squilla, Councilman Osada, Councilmember Vaughn. I commend you on holding these hearings. As a family court judge for the past 5 years, I've dealt with thousands of people with criminal records and their children. I have the following observations to help you with the great tasks ahead of you. My testimony will concentrate on general objectives and not specific programs. As one who has lived in Philadelphia since I was a toddler, I feel frustrated by the eagerness of many parents to move out of the city due to safety concerns. As one required by law to make decisions on custody in the best interests of the children, I find myself all too often sending children out of Philadelphia. We need a city which attracts more people and which repels fewer people. I agree with Councilman Johnson about prevention, intervention, and enforcement. More should be done in each of the categories. A partial list of my concerns follow. First, we cannot write off the many Philadelphians with criminal experience. These citizens can restructure their lives, as they often do when they have children. Jobs, therapy, and getting severe reductions in marijuana, alcohol, and hard drug use are helpful factors in turning people's lives around. I have had the privilege of hearing countless success stories of former criminals. Second, domestic violence is a common occurrence. Women or men so victimized should be encouraged to go to shelters or otherwise leave their abusive spouse. The recent horrifying beheading of a woman in Lawndale is an extreme example of the all too common repeated domestic violence. Children are traumatized by domestic violence and given bad role models. Third, education is sharply important to many parents. The schools must be made safe at all times. Teenagers should be strongly discouraged from using guns, talking about using guns, or accepting violence as a means of solving problems. Kids should be taught in schools, recreation centers, and other programs to calmly talk out problems rather than escalate them by violence. So should parents. Fourth, deterrence of criminal activities has to be an objective. On the positive side, children should know they have a choice between a law-abiding life and a life of gunfire, early death, and imprisonment. Children should learn the severity of prison lockups and the benefits of jobs producing legitimate income. Students should have ready negative answers to appeals of drug dealers to run errands for them and work their way up the drug dealing ranks. Fifth, Community College of Philadelphia must be a more active partner in inspiring kids to the future. All too few low and moderate income students and their parents see college as a viable option. Kids and their parents should be able to imagine a good future for their children, and a college education should be part of that for more students than it currently is. Sixth, I commend the police department for its expert data gathering and forensic investigation of DNA and other issues. The decline in murders in Philadelphia, which is 41 murders to date, down from 2021, is almost the same as the decline of murders over drugs, down 46 from 2021. This shows how important reducing drug crimes can be. I would hope that this effort on reducing drug crimes would continue. It would do a great deal to reduce our murder problem. Seventh, as part of recruitment as part of recruitment efforts, I would urge a reevaluation of the police screening process. The allegation by one of the mayoral candidates that living with a felon can be disqualifying for an applicant for a police job should be thoroughly investigated. If it is disqualifying to live with a felon, it should not be. 2- and 3-generation families are not uncommon, especially in low-income areas. The number of people living with felons is high because Philadelphia has hundreds of thousands of felons. The housemates of felons should not be disqualified. I could go on, as could you. This is a serious challenge facing Philadelphia, perhaps the most serious challenge facing Philadelphia. I wish you Godspeed and good luck and continued effort in dealing with these serious problems that we face. Thank you very much.
Thank you, Judge Cohen, and thank you for taking time out of your schedule and participating in this hearing.
Matt.
Any other people here for testimony and doing public comment? Hearing none. This concludes the special committee on gun violence. I want to thank all my panelists for taking time out of your schedule and participating in this very, very critically important hearing. Thank you very much. I want to thank all my colleagues. Specifically, I want to take a moment to give a shout out to Councilman Sharon Vaughn for sticking and staying throughout this hearing. This is the #1 issue that we're addressing here in the city of Philadelphia. So
yes,
your participation and your presence is definitely noticed, but definitely means a lot. Thank you, everyone, and you have a good one.
take care.
Take care.